So, hey everybody, my name is Matt, and tomorrow I'm getting an orbital floor fracture repair done. They're gonna have to go in for surgery to fix my displaced orbital floor and my depressed medial wall of my left eye. This is the broken eye. Everything I read said that this surgery should be performed within 2 weeks of the injury. I'm sitting at a pretty 10, maybe 11 weeks right now, so I'm a little bit nervous about the surgery tomorrow, but you know, something that's probably doesn't need to be fixed, but that I'd like to have fixed. I have double vision looking up and to the left. Whether that's just because my eyes are offset or because of tissue damage, I don't know. I have about 3 millimeters of enophthalmos though, which means my eye has been sunken back this way, about 3 millimeters. And you can kind of tell, I don't know how bad it looks to y'all, this is my face so I can tell, but obviously you can tell the eyelid looks a little different, right? But pay attention to the eye away from you when I turn my face. So you see, this is a bad eye, look how pushed in it is compared to this eye. See how the definition's a bit different? So hopefully the sunken eye will get fixed, and hopefully even better, the double vision gets fixed. I don't know, I figured it's worth a shot to get this surgery done. There's always the possibility of my eye sinking back more in the future. I don't really know how that stuff works. I'm not an ophthalmologist, but that's what I both read and what both of my potential surgeons told me. So yeah, they say once you have the injury and you go in and check, they'll determine within 2 weeks whether or not you're gonna have the surgery or not. I went to the ER right the day after my injury. I thought I had concussion. I had well, my face was going numb after I broke the eye socket. I didn't know my eye socket was broken at the time. It was just I thought I just had a black eye, you know. But turns out he told me you got some broken bones in your head. So he referred me to, I don't want to get too into everything, why my surgery got delayed. It got delayed for a lot of reasons, from insurance reasons to scheduling reasons to I was just graduating law school 2 weeks ago, and I didn't want to, have to give up a semester, really 3 years worth of work, kind of to get the surgery done immediately. So here I am. I'm in this situation that I'm in. But anyway, the point of this video is just to give you guys a pre-update or a pre-operative good look at me, and you can hear about my situation, because there's really not much there's really not much information from real personal knowledge of people going through this type of procedure. There's a lot of scholarly articles which I've skimmed through. I've read just about everything on an orbital fracture now. I know way too much about it. I've watched so many surgery videos, so I know exactly what they're doing to me, what type of implant they're using, the technique. They're gonna do a wraparound technique because I got 2 broken bones in there. But like I said, there's one YouTuber out there that I'd like to give a shout out to. I think his name's pronounced Zine Themis, and he gave his updates from his injury, and they were very helpful. He answered my questions when I asked him about it, because it's a scary injury. I mean, it's just, you think, oh, a broken eye socket. I mean, it sucks, but I got double vision looking up, and I got double vision looking to the left, and it makes it kind of uncomfortable for daily tasks. The cosmetic issues of it, I really don't think it's all that noticeable. I notice it because it's my eye, but if it's something that really bothers you, maybe you'd consider getting it too. Hopefully you don't never break your eye socket like I did. But but yeah, my surgery is set for tomorrow morning. We're gonna see how it goes. I think the more interesting videos are gonna be my post-operative ones, so you guys can see the recovery, how it looks when it's recovering. I can detail y'all how what the pain's like and all that stuff. Tomorrow I'm probably gonna be a little bit too inebriated. I guess is gonna do general anesthesia on me, so probably going to be KO'd for a while, and I'm going to be out of it the rest of the time. But you know, definitely this week I'm going to give a follow-up and just give you guys a rundown on how I recover. And that way, hopefully, if any of you are ever in this situation, you can weigh the pros and cons of whether or not you want this type of surgery. So what they're basically going to do, if you care, is they're going to cut me open underneath the eyelid in here. They're going to dissect the periosteum from the bottom of my eye socket. I haven't seen the CT scan, probably for the best. But since I have a broken bone on this end and a broken bone down here, I imagine most of my volume of my orbit is down here, all the muscle and fat and all that. So imagine I'm going to pull all that up. Then they're going to cut me open around here, inside of here, pull everything out from there, put in an alloplastic implant to hold my eye, and hopefully it's going to look like this one afterwards. You know, because you can definitely tell one's a bit smaller than the other when I look up. You can kind of see it's a little funky. I don't think it's noticeable, especially when I wear my glasses. But, you know, if I got a chance to fix it, I imagine it only gets more complicated to fix it the later it goes because of the scar tissue, because those are very densely vascular tissues in there that should never really be beaten on, so they scar tough, and well, you know, they scar in a complicated way. You know, it depends on your situation. I have to break bones to get into it. I don't think I'm gonna have to do that with mine because my fracture was so big, but you know, hoping for the best. I'm gonna post a video in a couple of days, just so we'll see, and hopefully, because there's no one really there that can really relate to you personally with this kind of injury, you know? I mean, you got your doctor, who they're looking at it more as, you know, how we're gonna fix it. You got your friends that are there for support, but you don't really have anybody with personal knowledge of this injury. At least I didn't. And so it's nice to hear from someone who's gone through the injury and gone through the procedure to fix it, and that you can listen to. So, you know, that's what I'm doing this for. So feel free to write down any messages in the comments section, and I'll get back to it as soon as I possibly can, because I remember asking questions and how happy I was when someone finally got back to me. So I'll get back to you as soon as possible. So thanks for listening, and let's hope for a good outcome tomorrow. And I'll be looking a lot more beat up next time you see me, but you know, it's all for the best. So thanks for listening. Bye.